Well, good afternoon, and thank you for joining me for another leadership dialogue. It's my hope that you had a great holiday and that you're back and ready for action. I'm Wright Lassiter. I'm the Chief Executive for Common Spirit Health, and I'm the 2022 Board Chair for the American Hospital Association. As I near the end of my chair and my hosting of the AHA Leadership Dialogue Series, let me just start by just saying to all of you how much I've enjoyed the opportunity to speak with colleagues from across our field, representing so many different types of organizations, large and small, urban and rural. I have learned immensely from the individuals that I've had the opportunity to interview and dialogue with, focusing on different challenges facing our field. But through all of these conversations, what's been clear to me is a consistent commitment to patients, a consistent commitment to making healthcare better. And I'm very, very proud of our field and the work that we all are doing. And today, I am pleased to welcome a colleague and a good friend to talk about the value of systems, the value of health systems. As you know, I've been privileged to be part of a number of systems over the course of my career, and now here at Common Spirit, where I have the opportunity to serve a ministry that has healthcare teams across 21 states. So we certainly have a large and diverse footprint, but we have a singular mission to deliver access to high quality essential services for all. And despite being a large healthcare system, the work that we do at Common Spirit always begins locally. It begins at each of our hospitals and our care sites that are focusing on meeting the unique needs of their individual communities. And so we also, though, as a large system, have the ability to integrate and to coordinate across multiple care sites to make sure that we're delivering high quality health care and that we're enabling great patient engagement, great employee engagement, while also exploring innovations that are feasible because of our size. So let me just mention a couple of things that I'm excited about at Common Spirit before I introduce my esteemed guest and we get into a really great dialogue today. We're working currently on creating an internal nationwide staffing agency to create a platform where nurses can work across our 21 states without having to leave their employer, without having to lose seniority, without being outside the benefits and the mission of an organization that they care about. It's certainly unique, and we're hopeful that it will serve as a beacon of innovation and ideas for nursing across the country. We're also working on virtual integrated care. It's something that we're piloting across 5 or 6 of our divisions, and it allows us to take advantage of our scale and support our nursing staff members to work at the top of their license by taking out of the day what some might call the more mundane or routine activities off the plate of our nurses who are ever burdened, as you know, with providing great care to the patients in our facilities. And then lastly, we just highlight quickly that we're working this fall on initiating what we expect will be the nation's largest nursing residency program. And we're thinking about the pipeline, and we're thinking about the fact that our field faces challenges with having sufficient nursing staff. And so we're working very intently on a comprehensive training program that we're hopeful can not only meet our needs at Common Spirit, but also serve, again, as a model for others to potentially emulate. So those are just a couple of innovations that we've been working on because of our size. And as I said earlier, our entire field is focused and grounded on the mission of caring. And we've never seen the impact of what hospitals and health systems can do as we've seen over these last few years. We've seen this commitment to compassion for our caregivers, value to communities. And so without further ado, I am very, very pleased to have my colleague and friend, Eugene Woods, join us today to discuss the value of integrated health systems. Gene is someone that doesn't need many introductions, but I do a brief introduction just for those who might not know who this gentleman is. Gene is the president and CEO of Atrium Health. And as you know, he also is a former AHA board chair. Gene's based in Charlotte, North Carolina. And Atrium Health, as I mentioned, is an integrated not-for-profit healthcare system with more than 70,000 teammates serving patients at 40 hospitals across more than 1,400 care locations across both the Carolinas, North and South, Georgia and Alabama, and growing. Under Gene's leadership, Atrium is known to be an industry leader in shaping health outcomes through innovative research and education and highly compassionate patient care. And because I know that Gene and I could talk for hours, we should focus our conversation on just a few things because we know that when you all listen to these dialogues, you pop in for 15 minutes or so, and then you pop back into your day job. So Gene, let's go ahead and jump in because you and I could talk for the rest of the day, and I know our listeners will want to hear from you on the key themes we're going to talk about today, which are scale, access. We'll talk a little about the state of healthcare finances and innovation. So Gene, let's sort of start with this. We know there's a complex public conversation happening right now about scale. Some who will talk about how scale benefits communities. Others will talk about how scale creates concerns. And so why don't you share, given your perspective, both in your current role and in prior roles, why don't you share your perspective on the impact that scale has in healthcare and the role of health systems today?
I'm happy to, Wright, and also just really good to be with you. And thank you for your service to the field this past year. We are unabashed believer in scale as long as it's well executed, well managed, well focused, well oriented towards what you just highlighted, community. And in fact, every time we've come together with another system, we ask ourselves one question, and we tell the board to hold us accountable for one question and answering it well, which is our community better because of this combination? And, I know there's a lot of literature out there where it's not worked. And if you think about McKinsey, they in fact say 70% of these combinations sometimes don't deliver on the promise. We've always intended and have lots of proof points that we would be in the 30%. And I'll give you a couple of examples. Obviously the pandemic, the systems like yours and ours really had to step up and really serve community different because the public health departments, as well intended and committed as they were to community health, just did not have the resources. And so, at any one time, I had 1,000 teammates in the middle of managing a pandemic out in the community, whether it's mass vaccinations, where we, on one weekend, vaccinated 30,000 people in the community at a Bank of America stadium where the Panthers play, or we were delivering up to 4 million masks throughout the community. So if you think about just having this ability to have that level of scale, we actually functioned as many did as a public health extension of what was required in the middle of a pandemic. And then, with respect to scale also, there's just so many efficiencies that we have found just in the last several years. We've driven about $350 million of efficiencies coming together with Wake Forest, and also our new family members throughout Georgia. And I shudder to think during this time when we're all dealing with some significant macro pressures, where we would be if we didn't have the 350 million plus in terms of efficiencies and savings. And then you alluded to growing the pipeline. What you're doing and what you mentioned with the staffing company, national, and what we're doing also with respect to, we have building a new medical school. We'll have 2 medical schools. We have a couple of nursing schools, and we're building pipelines into public schools. So 5th graders, 6th graders really have a vista to what's possible in terms of serving in the communities in the health profession. And again, having scale really helps that. In fact, today we have 3,500 learners, if you will, in our systems, and that's going to be the next generation that's really going to continue to advance healthcare going forward. So I'm a big believer. We are big believers that scale can really not only help weather storms, but really reposition organizations, not-for-profit organizations, to really deliver on their mission better in each of the communities that they serve.
Yeah, well, I really appreciate those insights, and I could echo many, if not all, the points you just made even further. But let's talk about this. You are not one that shies away from a headline periodically, and there's been a lot of headlines that you are on the precipice of finalizing a major combination with Advocate Aurora. And so maybe just talk a little bit about, and you alluded to how you've asked your board to hold you and your team accountable when you're looking at combinations, et cetera. Maybe you could just share a little bit of how you see this new combination impacting the mission that you're so focused on.
I'm really excited to be building this new system together with Jim Skogsberg, who we all know as well, a leader in the field, and also he served as AHA chair the year before I did. So just one of those leaders that I'm really excited to be working with. And really, when the reason to come together is exactly what I indicated, is how do we serve more communities better. One of the things that we have announced is that we are committing $2 billion to really disrupt the root causes of equity through the communities that we serve. And that's an incremental over what we are already doing in communities. You may know that we were recognized by CMS a couple of years ago for really eliminating or reducing disparities in Hispanic males for colorectal cancer and so forth. We're really going to elevate that to the next level, including in Milwaukee, which we will establish a Center for Health Equity. So equity is going to be a big focus for us. Environmental sustainability, we all both have significant commitments in that regard. And then just clinical excellence. We have such talented clinicians that will be part of this new system. For example, we will be one of the top 5 largest transplant programs in the country. We will diagnose about 40,000 new cancer cases every year, and think of the power of coming together really with the latest in terms of clinical trials and also clinical pathways. So we really start off with 2 organizations that are have served well and are strong from a talent in a revenue-based perspective, and we think that coming together and the complementary capabilities that we will have really elevate our ability to care for community.
Great. Would just say that as someone looking on from the sideline, it's exciting, and I wish you Godspeed and the best of luck as you continue down that path.
Thank you.
You've talked a lot about health equity. You've talked about commitments that you've made historically, and you even talked about some forward-looking commitments that you'll make with your new organization around health equity, et cetera. And we both know that COVID-19 pandemic has certainly created both challenges and opportunities for our field. We also know that it's clearly shown a bright light on highlighting areas of the greatest need, and in some cases, need that was already there, but for one reason or another, the light didn't seem to shine in the corner of that room. And COVID-19 seemed to sort of pull back those dark corners and show us things that maybe we didn't all want to see. Seeing scenes of pretty egregious disparities in communities of color and in vulnerable communities across our country. You've already talked about a few things that you all are doing, but let me just give you an opportunity maybe to share a little bit more about the commitments that Atrium Health is making to rid not just the Carolinas and Georgia, but now, as you highlighted, Milwaukee and other parts of the country. Just to maybe share a little more of what you guys are looking to do to try to ensure that disparities don't get to shine, don't get to have a light shown on them in the communities that you're serving.
I'm happy to. If you step back, the pandemic has really reversed 10 years of gains in terms of Black life expectancy in the majority population. And I think so we've got a lot of recovery work to do, if you will. And there's a statistic that I just can't get out of my head that I read that JAMA put out an article where 74,000 Black Americans die every year from health inequities. And that's the equivalent of a plane crash every year. And we know that the level of urgency that would create nationally, if that were to be the case, in terms of the headlines in the news every day. But as you mentioned, these deaths and these health challenges occur in the quiet corners of our community. And so, but we feel that intense sense of urgency about playing a lead role in really solving for health inequities. And right, I break it out in sort of three different buckets. I would say equity 1.0, which was the work that many of us started in the field in the AHA, as a matter of fact, where we were looking at making sure we were collecting real data, making sure that we were doing competency training for all our staff at all levels, making sure our boards and C-suites reflected the community served. And I kind of see that as just foundational. It's necessary, but insufficient to deal with the issue. Equity 2.0 is really how we showed up, in my mind, during this pandemic, is when the community needed us. What was our ground game during the pandemic? And, we developed relationships, for example, with this group of 60 churches. And we were working day in, day out during this pandemic to take our mobile vans into their parking lots to make sure that we were eliminating testing disparities, to administer vaccines and so forth. And, and we also developed new access points during the pandemic. I sit on the Best Buy board, and we talk about omni-channel approaches to retail. Well, we have an omni-channel approach to health equity as well, where we have an ability to take our mobile vans to where people reside, but also to interact, obviously, through telehealth. But also through bricks and mortars, because there's still medical deserts in our communities that need a physical presence. And during the pandemic, we actually developed or created 3 different new access points in medical deserts. And so I think that's 2.0. 3.0, I think, is really where we're entering now, is how are we architecting the future and embedding equity really throughout our organizations. And that clearly has to be starting at governance and leadership, but embedded also through strategy, through different systems that really will outlive our individual tenure in our organizations, including culturally. We have a mission providing health, hope, and healing for all. And really, we live by that. All 70,000 teammates that you referenced live by that every single day. And so I think we're entering into an Equity 3.0 situation where we intend to help be leaders in that regard. And I'll give you just an example. Right now we have our virtual health platform in 100 different public schools. So when a young lady, for example, is not feeling well and goes to her school nurse, we're beaming into that school and making sure that they're going to be okay. 80% of the time, we're realizing we don't have to call their parents to pick them up. Actually, they can go back into the classroom, or if they have to go home, we can expedite medicines that the parents can pick up on the way from work. And that way we're reducing absenteeism for the child, but also absenteeism in terms of work for the parents. So these are different sort of approaches that really cause us to extend who we are well beyond our walls, but also making sure that the systems inside just have a degree of sustainability, again, that outlive any one of us.
I know our time is getting short, and it always it's always shorter than I would like it. But I want to do maybe a couple what I'm going to call lightning round questions with you, and when you hear them, you're going to say these aren't lightning round kinds of questions, but just given how busy our viewers are, let's see if we can get a couple quick ones in. So one. Financial challenges. Our field is under significant financial challenges due to inflation, due to escalation in labor. How has Atrium found ways to weather the storm that our field is facing at the moment?
Well, we're all facing it, and Kuppenhall said that the field will take north of a $54 billion hit this year. The lightning round way of answering that is we realize the old playbooks don't work, and so we are inventing new playbooks through growing our own future workforce, if you will, through doubling down on the efficiencies and really fundamentally redesigning the work. We now have, for example, our nurses that are beaming into our ICUs to support young nurses in terms of providing high level of care. So it's really about right now redesigning the work.
Gotcha. Appreciate that. And then maybe lastly, we both talked about innovative approaches. You shared some things that you all are doing that are clearly on the cutting edge of healthcare. You've talked about partnerships in various ways. Maybe just answer this question, which always is an interesting one. Why? So why is Atrium focused on innovation? And why do you think it's so important for healthcare systems like Atrium and like CommonSpirit to focus on innovation?
Because we have to innovate our way out of the current models which we know are broken and don't work. And when you and I started Wright, we were called hospital administrators, then became health system administrators. I think the job now is being architects of ecosystems of innovation. And so we are currently building a new innovation center or district, if you will, in Charlotte, where we're bringing scientists, companies, medical students, clinicians all together to really think hard about what needs to change now and in the future to really evolve as health systems serving community. And so we also have in Winston-Salem, as part of our relationship with Wake Forest University and medical school, we have our IQ Center there, where we have one of the leaders internationally, Dr. Tony Atala, really in regenerative medicine, and we're really looking to translate that into the hands of our clinicians, so that we can really at the core level, at the patient level, can really bring the latest science there. But also we're also innovating around delivery systems, and I think innovation is who we are at the core, and really unleashing the power of the talents that each of us have throughout our organizations and our systems is really the way to the future from here, and to a brighter future.
Well, I would just say I would just say that to our listeners, if they listen to the pitch in Gene's voice and how his smile continued to grow the more he talked about innovation, I would just say I share his excitement when we're able to bring new approaches to allow our team members to be their best selves at work, and to allow our patients and communities to receive what they deserve. So I think we should end on a high note, Gene. As I'm looking at our clock, I'm always cognizant of people taking time out of their day to listen to these leadership dialogues and hopefully glean a few nuggets and then go back to their day job. So I want to just say to you, really appreciate you sharing examples of how Atrium is investing deeply and broadly into communities to make life better for the citizens and residents that you all serve. I want to thank you for spending time with me today to talk about the future of Atrium Health as Atrium and Advocate Aurora become one, and you increase your span of influence across the United States. I would just say to our listeners, it's been a sincere privilege for me over the course of the year to do these leadership dialogues. I always tell folks that there's mutual benefit here. While the benefit should accrue hopefully to the audience, but it also accrues to the moderator, who gets a chance to sit down with amazing individuals who care deeply about the field of healthcare and making life in the United States better. So, Gene, thank you again, and to our listeners and viewers of Leadership Dialogue this time. Again, I hope you had a great Thanksgiving holiday season, and I wish you the best for the rest of the year. Thanks very much.
Thank you.